predominantly early in my career was in hospital settings, but had the opportunity to create and develop the birth center that was part of UCI Medical Center back in the 90s. And that was really an innovative opportunity because birth centers were just not heard of.
I mean, even now.
Right.
Definitely not as common even
right.
today.
But it was really uncommon then. And I have to applaud their efforts of understanding that there were many different ways to provide care for women. And one of the things that we did not do well in hospital situations was care for women that were low risk. Everybody was treated as high risk. And then if you ended up being low risk, it was like, good job. It's not necessary to get a pap smear every year. And it's so funny because women would call and say, I need to schedule my pap smear. They wouldn't call and say, I need to schedule my annual exam. And so we're having to re-educate women, and I think the public, that you don't need a pap smear every year if you don't have any significant history. But you do need that breast exam. You do need the review of your health. And so that's really what we have kind of shifted over the years to be able to provide for women. Unfortunately, 50% of all pregnancies in the United States are not intended. That doesn't mean that they're not wanted, but it's like, oops.
That's a lot of mistakes walking around.
It is. Or a lot of
blessings,
surprises, and blessings. Right. So we try and do a little bit of education about, okay, are you planning to get pregnant within the next year? Here are some of the things that you need to do, in preparation for that. I always say, if you're not preventing, then you're planning. No. With traditional practices, it's the nurses will evaluate you, and the nurses are very good. I'm not saying they're not good, but the provider then comes in at the very end. And I have found from my own perspective, and I think most nurse midwives will tell you this, that if you are there with a woman in labor and you see how she is managing and you assist and support in that management, you don't have to do multiple checks because you know that she's progressing. It's not that you wouldn't get checked again, but many times, I would say all of the time, we have significantly low rates of doing pelvic exams during labor because we're there in the labor with you.